Hi, this is Yakub. I have joined the call.
Yes, sir. Can you hear me?
Yes, I can hear you, but can you just reduce the volume a bit?
Sure, sir.
Are you guys able to hear me?
A very good morning to all the participants present today on this virtual platform. I am Shweta, Secretary in the Department of Computer Science. On behalf of the management, principal, and faculty of Baldwin University College, it is a pleasure to welcome you for the webinar in Disaster Management and Risk Management, organized by the Commerce Department in coordination with the Internal Qualification Cell of our college. At the outset, I would like to give a brief history of our college. Mr. John Baldwin, having educated himself as a mechanical and trucking person, he had education in Houston. He founded the Baldwin Institute in New York in 1845 and Baldwin High School in 1886. The Baldwin Girls' School was established in 1903 and continues to provide quality education to girls in Bangladesh, other states of India, and other parts of the world. By the year 1990, the need was felt to the good higher secondary education mobility. The PUC sector was started and it was expanded with addition of the sector in 1995. The Baldwin University College is managed by Mr. India. The DP section is affiliated to Bangalore University and online affiliation to Bangalore Central University. Now, I call upon Mr. Gupta, Secretary and Department of Commerce, to introduce the research person. Thank you.
Thank you, Mrs. Shweta. Good morning to everyone present here today. Our speaker for today is Mr. Mohammed Yaqub. Sir was born in a quaint French town of Pondicherry about 50 odd years ago. Did his schooling in Uti. Sir completed law in Pondicherry and passed out with a couple of gold medals and then started practicing law in Uti. He meandered into Bangalore in 1998, practiced law again till 2004, then worked with multiple corporates for the last 15 years and is currently the Legal Director, OFSS, Compliance and Ethics Officer at Oracle. Sir will be speaking on the topic Disaster Management and Force Majeure. A hearty welcome to you, sir, and over to you for the session.
Thank you, Madam Moderator, and a very, very good morning to all of you. At the outset, I would like to send greetings and present to you my deepest gratitude for having given me this opportunity to discuss a rather more important and a more current situation that we are facing, and we are just trying to kind of understand the laws and the regulations that are controlling the situation. In fact, these are the laws that the government is invoking in order to ensure that we are going to be in compliance with, and we are going to save a lot of people. So with this, let me just straight away head into my presentation. Can you please? I'm likely to present, so can you invoke start the presentation? Can you please stop the presentation? BMC presentation, please. Can you just stop it so that I can start my presentation? BWMC lab, can you please stop the presentation? Hello?
Yes, sir. We are hearing you.
Yeah, thank you. Because without you stopping the presentation, I will not be able to flash my presentation on the
Yeah,
screen.
1 minute, sir.
Yeah.
Yes, sir. You can go ahead, sir.
Is my presentation visible to everybody? Hello? Can somebody just respond? Is my presentation visible?
Presentation is not visible.
Yes, sir.
Wonderful. Thank you. Now let's straight away go into the topic. The topic that we are going to deal today is COVID-19, legal and statutory framework, and there is going to be a special emphasis on Disaster Management Act 2005. As we go along, I will also be touching on a concept which may be foreign to a lot of people, but for lawyers, this is a rather regular standard contractual term that we use in all the contracts. It's called force majeure. So now I would like to start with a legal maxim, which is a Latin maxim. It says, ignorantia fact excusat, ignorantia juris non excusat, or ignorantia legis neminem excusat. The meaning of this legal maxim is ignorance of fact is excusable. Ignorance of law is not an excuse, or ignorance of law excuses no one. Now, ladies and gentlemen, a lot of people think that law is for lawyers, and we don't really need to know the law. However, that would not be the right way to look at it, because the law expects every one of us to know the law. The reason why we need to know the law is because we have to kind of follow the law. Without knowing the law, we cannot follow the law. All right. And let's say we kind of transgress some law and we get arrested and taken to court. We cannot claim in the court of law that we did not know such a law was existing, because that would not be a good defense. So it is extremely important that we know the law. And generally, we are aware of the current laws that we kind of, we interact with on a day-to-day basis. But now we are being faced with a situation which is unique, which has not been tried or tested earlier. We have been faced with a COVID situation. So, an extremely rare situation sometimes requires the government to invoke some extremely rare laws or to enact some extremely new laws. All right, but in this case, unfortunately, in the case of COVID-19, the government has chosen to invoke certain laws which are more than 125 years old. So it is quite possible that many of us may not know that such a law exists or how to comply with that law, and therefore we might advertently or inadvertently, we might kind of transgress the law and we might put ourselves in danger. So today's session is primarily to give you a flavor of the various laws that are applicable to the COVID-19 situation. So, I do not really have the bandwidth to kind of to expose all the laws that are applicable. But what I'm going to try to do is I'm going to try to take you on a journey of the most important laws which are being invoked currently, by the government in order to tackle the COVID situation. Now, before we actually go into the legal framework, I just want to take a breath and take a step back and just share with you a small snapshot of the events the events the way they have flown. Now, you might be aware that COVID-19 is a virus which comes from the same family of viruses which are called SARS or MERS. In fact, SARS and MERS, these were even more potent uh, viruses than COVID-19. But what makes COVID-19 rather lethal is its ability to affect a lot of people at the same time. So it has created a fear psychosis among the people. So people really do not know how to react when they are impacted by this particular virus. The first and this virus originally originated from China, from the Wuhan province, and the first known case that was reported in India was on January 30th, 2020, from the state of Kerala. Today, India is in the third place globally in terms of the number of COVID cases, with more than about 32 lakh cases and 58,000 deaths. The only two countries above us at the moment are the United States of America and Brazil. However, the silver lining on the cloud is the fact that India's fatality rate is amongst the lowest in the world. In fact, out of every 100 people who are impacted by the coronavirus, we have a fatality rate of 2.41. On March 22nd, we observed a public curfew. This was done at the request of our Honorable Prime Minister. And before the nationwide lockdown on March 24th, 2020, many states enforced the mandatory lockdowns from March 23rd to March 24th. Now, there have been many measures that have been taken by the government of India, by the various state governments, by the local governments, and some of these decisions have been taken on the advice of the World Health Organization, especially where the question of lockdown and quarantines is concerned. Now, travel, both domestic and international, have been regulated, as well as have been regulated as well. Recently, The Aviation Ministry has made COVID-19 tests mandatory for air travel, both for domestic and international travel. Now, the next part of my discussion, which is the meat of today's discussion, are the laws that are available and invoked by the government to control the spread of this epidemic or pandemic. And these are the laws that we, as citizens of this country, who are facing this monster, need to be aware of. The Epidemic Diseases Act of 1897. Then we have the Disaster Management Act of 2005 and the National Disaster Management Guidelines 2008. Then we have the Criminal Procedure Code. We have the Indian Penal Code. We have the Essential Commodities Act 1955. We have the Essential Services Maintenance Act 1968. And we also have the Drugs and Cosmetic Rules 1945. Now, you might ask me, hey, are these the only laws? Is this an exhaustive list? Is this an exhaustive list of the laws that the government has invoked or is using? The answer to it is no. This is not an exhaustive list. This is only an indicative list. But if you are aware of these laws and if you comply with these laws, the chances of you transgressing any rule or regulation or related to COVID-19 gets mitigated abundantly. So if you can go back whenever you have the time, and if you just pull out these laws, because these laws are available on the net, you can just pull them out and just read them. And you will find that it's not extremely difficult to understand. And in case you have an issue and you are unable to understand, you can always get back to us and we'll be more than happy to help you understand these laws. So let's first go to the Epidemic Diseases Act. Now, this Epidemic Disease Act, as you see, is a relic of the British era. It was passed in the year 1897. Now, this law was essentially passed in order to control and take care of the bubonic plague that affected the Indian state at that time. So the law basically, the entire statute contains just about 5 to 6 sections, and it is a very, very cryptic law. It does not give you any procedures. It does not give you a chance to challenge any of the act that is done by the government. It is like, it is to a certain extent, you can call it a law which does not have a great legal depth. But then, this is a law that is being used today by the government in order to, get a handle on the COVID-19 situation. Now, under this law, the state government and the central government, they have they have been given, huge powers. And when the state government or the central government feel that the current laws, which are already there, are inadequate to control the outbreak of or threatened outbreak of any dangerous epidemic, then the Epidemic Diseases Act 1897 may be invoked and has been invoked, and obviously it has been invoked with public notice. Now, this law provides for segregation. In fact, this is this is a law where people can be inspected when they are traveling or otherwise. It also provides for segregation in hospitals, temporary accommodation, or otherwise of persons suspected by the inspecting officer of being infected with the disease. Now, here you cannot claim that, because sometimes this COVID-19 can be completely asymptomatic. There may be no symptoms. You might not have fever. You might not have cough or cold or any of these symptoms that are usually associated with COVID-19. But even assuming you don't have those systems, but if the officer feels that you need to be segregated, then he has the power to kind of order segregation and quarantine for you under the Epidemic Disease Act. And the next section is any person disobeying a lawful order by an authorized authority under the Act shall be deemed to have committed an offense under Section 188 of the Indian Penal Code and can be punished with the prescribed punishment. Today we are living in a world where social media plays a huge role. And this social media is used mostly for good purposes, but sometimes it is used by mismongers to spread rumors, unauthenticated information, and this is done with a malafide intention. So if you or anybody spreads any rumors or forwards any unauthenticated information, then please be aware you might be transgressing the law and you may get incarcerated for it. Now, if a person has been authorized under this particular act to do any act, as in like, let's say an officer has been authorized to ensure that, people who are quarantined remain in quarantine. And if any person makes you stay, if he forces you to be quarantined, then tomorrow you cannot go to a court of law and say that, you have been wrongfully confined because no lawsuit or legal proceeding can be brought in any court of law against any authorized person for fulfilling his duty under the Act. The next important piece of legislation, I think this is the most important, this is the heart of the legislation that is dealing with COVID today. This legislation is known as the Disaster Management Act of 2005, and it also has the National Disaster Management Guidelines of 2008. The legislative intent of the Disaster Management Act 2005 is to provide for an effective management of disaster. Now, you may ask me, what is a disaster? What does disaster mean? Well, unfortunately, the word disaster has not been defined because it actually defies definition. Because what is normal under certain circumstances can be treated as a disaster in another. But disaster primarily means which threatens the life and liberty and the property of the people as a whole. So if you use that barometer to understand what a disaster is, then we can clearly conclude without a shadow of doubt that COVID-19 is an unmitigated disaster, a disaster of sorts. So the National Disaster Management Authority, this is the nodal authority, okay? It's under the Disaster Management Act is a nodal central body, and this actually coordinates disaster management, and the Prime Minister is the chairperson of the NDMA. One of the main jobs of the NDMA is to lay down policies, plans, and guidelines for management of disaster. Now, in this case, you will find that the NDMA has been providing guidelines, has been providing advisories from March 24th. From the day the lockdown has started, we have started getting guidelines. And other than the national guidelines which come from NDMA, we have been getting state-specific guidelines from the SDMA, that is the State Disaster Management Authority. So we are supposed to kind of follow those guidelines because that is one of the mechanisms by which we can mitigate the spread of this particular virus. Now, we have the state, district, and local level district management, disaster management authorities that have been established, and these agencies are required to work in coordination with the NDMA. So, till date, NDMA has formulated about 30 guidelines on various disasters, including guidelines on management of biological disaster. The 2019 National Disaster Management Plan deals extensively with biological disaster and health emergency. Now, this is the plan, the National Disaster Management Plan, is the legal framework under which the efforts to contain COVID-19 are being carried out by the union and the state governments. Now, all this is fine, but if you do not have the power to enforce those plans, enforce that guidelines, enforce those laws, then those entire laws, plans, etc., they become of no use. Right? So the law, that is the Disaster Management Act, gives huge powers to the central government and to the state governments to ensure that the guidelines, the plans that have been provided by the NDMA or the SDMA are being fulfilled by all the people. And in fact, this law actually overrides any existing law in force in the country today. Which means that if there is a conflict between the Disaster Management Act and any other law in force, then the Disaster Management Act overrides, supersedes the other generic law that is applicable or that is prevalent in the country on date. That is why they said, irrespective of any law for the time being in force, the central government can issue any damage to any authority anywhere in India to facilitate or assist in the disaster management, and most importantly, and such directions issued by the central government and the NDMA must necessarily be followed by not only by the people, but by the Union Ministries, by the state governments, and the state disaster management authority. Now, the present national lockdown was imposed under the Disaster Management Act as per the order dated 24th March 2020 of the National Disaster Management Authority. And this was to take measures for ensuring social distancing so as to prevent the spread of COVID-19. Additional guidelines were issued on the same day by the Ministry of Home Affairs, and this is the ministry that has administrative control over the disaster management. Now, after this particular order, there have been many orders that have been passed from time to time. And these orders have come, and lockdown one was there, and then it became lockdown. Lockdown one was 21 days, then there was lockdown two, then there was lockdown three, and then the economy started opening up, so those guidelines started coming in. And today, most of the states have done away with almost all restrictions except for a few states like the state of Tamil Nadu, where we still see that there are some remnants of lockdown in terms of traveling, let's say from our district to a district or from a city to a city, where you need to kind of get the permission of the prescribed authority before you can do that. So, except for some of the states, most of the states have actually done away with almost all the restrictions. And I think Karnataka is one of the first states where almost all the restrictions have been taken away, except for a few restrictions relating to metro and cinema halls, etc., etc. And this again would probably go away in a short time once the vaccine is ready, which I think is going to happen shortly, probably by the end of this year. That's what I get to hear. Now, if you fail to comply with the Disaster Management Act, as I stated earlier, you can be taken to task, you can be punished under various sections of the Indian Penal Code. Now, not only Indian Penal Code, the Disaster Management Act itself provides a mechanism under Section 51 for people who refuse to comply with the obligations under the Disaster Management Act. In fact, Section 51 says whoever, without a reasonable cause, obstructs any officer or employee of the central government or the state government or a person authorized by the national authority or the state authority or the district authority in the discharge of his functions under the Act, or B, refuses to comply with any direction given by or on behalf of the central government or the state government or the National Executive Committee or the State Executive Committee, sorry, or state executive committee or the district authority under this act shall on conviction be punished with imprisonment for a term which may extend to 1 year or with fine or both. And if such obstruction or refusal to comply with the direction results in loss of lives or imminent danger thereof, shall on conviction be punished with imprisonment for a term which may extend to 2 years. Now, in fact, there are from section 51 to 58, these are notes on clauses. Now, that those notes clearly say these lay down what these actually define what constitutes the offense in terms of obstruction or functions under the Act, false claim or relief, false claim for relief, misappropriation of relief material or funds, issuing a false warning, failure of an officer to perform the duty imposed on him under the Act without due permission or lawful excuse, or his connivance at contravention of the provisions of the Act. The clauses also provide penalties for these offences. Now, you can see that the law is self-sufficient in terms of punishing the guilty. However, it is not required that only this provision needs to be invoked to punish people who disobey. There are other laws under the general under the general laws that are applicable. The general criminal law, the substantive criminal law that is applicable in the country is the Indian Penal Code, or as fondly known as IPC. So under the IPC, there are provisions which we will come to in a minute, which actually provide for punishment, for trying and for punishing people who do not comply with the laws that are in force in the country. Now, other than these legislations, these two legislations are the heart and the soul of the laws that are fighting to kind of, control this pandemic called COVID-19. But then there are other laws as well. Now, the most important and interesting law is the section 144 of the Criminal Procedure Code. Now, in fact, you keep hearing this, oh, section 144 has been promulgated here. Section 144 has been invoked here. And a lot of people really don't know which particular statute they're talking about. They're actually talking about Section 144 of the Criminal Procedure Code. Now, this Section 144 of the Criminal Procedure Code imposes power on the executive magistrate to restrict a person or a group of persons residing in a particular area while visiting a certain place or area. That means people can be stopped from moving from one place to another within the same city, or from city to city, or from city to district, state to state, and so on and so forth. The most important preventive measure against corona is safeguarding by this section that it restricts to a gathering of people and thus in a way supports social distance. Now, under this particular section 144, what actually is stated in the law is no four people will join together and stand in a particular place, a public place, and do activities which they would do normally. Like probably in a tea shop, you find so many people. When Corona was not there would be a bunch of people who would be standing there and talking and discussing and so on and so on. Or in restaurants, in various other places, people would join together, friends, and they would generally have a good time meeting each other. But when Section 144 is promulgated, all these activities of joining together and having a good time essentially come to an end. Now, this is very important because invariably people, we in India, do not have a great sense of social distancing because we really like to kind of, keep close to our people. We generally are very, very touchy people. But unfortunately, the spread of this virus can happen with a touch. If somebody sneezes, the virus spreads. So social distancing, in order to ensure that social distancing is maintained, 144 is an important tool in the armory of the government, and it has been using this extensively. Then we have Section 188 of the Indian Penal Code. In fact, when we are talking about the Epidemic Diseases Act, I referred to Section 188 of the Indian Penal Code. Now, this prescribes punishment for disobeying an order duly promulgated by a public servant. The above-mentioned law is also for defaulters who disobey the orders of public servants. So, when somebody tells you, like, you're supposed to, a person who's authorized, let's say in this case, policeman, tells you that, you need to wear a mask. And if you disobey, you can be held liable under Section 188 of the Indian Penal Code. Let's say the policeman tells you that you cannot go from one place to another, and you still go without taking heed. You are committing an offense, and you can be held liable under Section 188. Therefore, this section is if there is an order promulgated by an authority, a person who is authorized by the government, and if somebody disobeys it, then you will be liable under the section. Then you have the section 269 of the Indian Penal Code. This is to do any negligent act which is likely to spread infection of the disease and endangers life. Example, again, a mask. You are expected to wear a mask because if you sneeze without a mask, then there are millions of virus particles that you let in the air. And anybody who comes in contact with the sneeze material that you have actually expelled, you would be spreading this disease. And this is actual negligence. And if anybody does this act of negligence, then he can be punished under Section 269 of the Indian Penal Code. Then we have Section 270 of the Indian Penal Code, again, which is a malignant act that is likely to spread infection and endangers life. This law is for those who know the consequences of their action and yet they choose to do it anyway. This is like, this is 269, section 270 is nothing but 269, section 269 plus. We have section 271 of the Indian Penal Code, which is disobedience of the quarantine rule. This section clearly says whoever disobeys the quarantine rule shall be punished with imprisonment of time both. Now, this is something that we have been seeing rather regularly. When somebody is traveling, let's say from another city to another city, and he's prescribed with a quarantine, he takes it very easy. And he's there out there, he's going for shopping, he's going to meet people, and virtually like living a very normal life when he is supposed to be in isolation in his own place where he has been quarantined or where he has been ordered to be quarantined. But there's absolutely no sense. People just do not understand. And I actually came across a case where a person had traveled to India from another country, which was at that time a hotbed of COVID cases. So when he came to India, uh, there was a stamp on his hand, and he was expected to be quarantined for 14 days, though he did not have any symptoms. But within a couple of days, I see this person out shopping for vegetables. And if an authority finds him, and if he is taken to a court of law, then he will be punished under the section 271. So, one request to all of you is, in case you have been prescribed a quarantine, please do not delay. Please do not put yourself in harm's way. Then we have some small statutes like the Essential Commodities Act, and where the government, because if the government does not intervene, people will start hoarding things. Like people tried hoarding masks, people tried hoarding sanitizers, and so on and so forth. Now, because of the Essential Commodities Act, the government has been able to regulate the production, supply, and distribution of essential commodities. Then we have the Essential Services Maintenance Act, which is otherwise known as ESMA. This is another law that needs to be used from time to time to ensure that people get essential services. Like for example, medical personnel are have been brought under the ambit of essential services. Railways or postal service are essential services, which means that these people cannot actually say that we are not going to come to work. If they do that, then they will be like, if I say I'm going to go for work when I'm supposed to be at home, then that is an offense. But under the Essential Services Maintenance Act, a person who's supposed to go for work refuses to go for work, then he is committing a crime. But then everybody is afraid of their own lives. But then the government also has a duty to do, so they invoke the Essential Services Maintenance Act to ensure that essential services are maintained. Then we have the Drugs and Cosmetic Rules 1945. This is again, these rules classify various drugs, like you sometimes see in the medical shop, Schedule H drug. These are drugs which cannot be sold over the counter. They are supposed to be sold only on a prescription of a registered medical practitioner or a doctor. Now, one of the drugs that has been in news is the hydroxychloroquine, which is the antimalarial drug. Now, this has been in news for various reasons, including US asking India to provide it with a lot of hydroxychloroquine. Now, this formulation also is supposed to be was brought under the classification of Schedule H1, and this is again cannot be sold over the counter, but it has to be sold only on the prescription of a registered medical practitioner. Now, with this, I would like to end the topic regarding the various legislations that the government has involved. and the legislations which we are supposed to follow. And let us just move on a bit and let's see what is this concept of force majeure. Sounds very interesting. The term force majeure has been defined by Black's Law Dictionary as an event or effect that can neither be anticipated nor controlled. It is a contractual provision allocating the risk of loss if performance becomes impossible or impractical, especially as a result of an event that the parties could not have anticipated or controlled. While force majeure has not been defined anywhere in the Indian Contracts Act, you can see some remnants of it under Section 32 of the Indian Contracts Act. And the force majeure clause in the contract would typically include an exhaustive list of events which are considered to be force majeure events, like act of God, war, terrorism, earthquakes, hurricanes, acts of governments, explosions, fire, plagues, and epidemics. But then this is not a complete list, and the parties to a contract can agree on what would constitute a force majeure situation. And once they agree, then it will bind these two parties. And if one party is unable to provide his part of the contract because of a force majeure situation, then he gets a reprieve. That is, they cannot go to a court and enforce him to do. Like, for example, let's say a person has agreed to provide painting service to your house, but he is unable to do it because of the COVID-19 situation. You cannot claim that this man has breached the contract and therefore he should be sued and and damages should be claimed from him. That would be incorrect because he will be saved under this provision of force majeure. Now, COVID-19 and this unfortunately for force majeure has been invoked rather extensively by many businesses because of the COVID-19, and that has created a lot of panic among the business folks. A lot of jobs have been lost, and a lot of people are scared of the future. But then, there's really nothing much to be worried about because adversity brings with it opportunity, and this is a great opportunity for us to learn new things. For example, I don't think any of us were ready to sit down and work from home, or your teachers were not ready to sit and teach online. But and if this situation had not arisen, we would not have learned how to do things without actually having to come into contact with one another. But this situation, this unfortunate tragedy prone situation, has still kind of brought with it some glories, some good things, which we can take a lot of heart with. And therefore, I would conclude by saying that everything is not lost. Yes, there are a few bumps on the road. There are going to be a few difficult times. But then we Indians are a very resilient people. And I'm sure we will overcome. We definitely will overcome all these challenges. So with this, I conclude my presentation and thank you all for sharing your time with me and listening to this lecture. And I now hand you over back to the moderator and for further for further activities. Rekha, thank you so much for your kind words. Really appreciate it. And people, in case you feel that you have gained something out of this presentation, please feel free to leave a good word. And in case any of you feel that your time spent has not been worth your while, please feel free to criticize. Don't hesitate. Because bouquets without brickbats or brickbats without bouquets are actually of no use. Every rose tree has to have a thorn. So do we have any further questions? Please feel free to ask. Don't shy away because there is nothing called a wrong question or a stupid question. Because in my opinion, the only stupid question is the one that does not get asked. So if you have any questions, my dear friends, please ask.
Audience, you can ask questions. Any questions from the audience?
When people don't ask me questions, I can actually the takeaway for me is only twofold. One is I've been so good that all of you have understood whatever I said, or I've been so bad that you guys have really not understood anything and you have nothing to ask. So please go ahead and ask questions, guys.
Any questions from the audience? Sir, I have a question, sir.
Please go ahead.
Sir, how do you think the government has been successful in implementing this law, the disaster management? Do you think they have been successful? Because there was a lot of violation of these laws.
See the success of the government because they are also learning on the job, guys. They have not encountered the situation. Nobody has actually encountered the situation. See, we've had disasters, but these disasters have been in small pockets, in special places. Like, for example, let's say the Bhopal gas tragedy was a disaster. But then it was in a small place, and therefore it was easy for people to kind of, control that situation. But when something is of a global nature, and actually speaking, people really don't know what they are confronted with. It's not an easy job. And the government, yes, has failed in many aspects, in my opinion, because they have not had the lockdown was abrupt. There was no thought that actually has gone through. The government has not gone through in depth. They have not called for people. They've not called for suggestions. They've not taken the experts' view. They have just gone ahead and they just inserted the lockdown. Now, unfortunately, they know that they have not been successful. They've not been able to control. Though the number of fatalities have come down, the number of people affected is rising constant, and every day we are breaking new records. So I think we have not had a good plan to to put the lockdown. We have not had a great plan to remove the lockdown. So we are all learning on the job, and a lot of mistakes, I guess, are being committed by everybody, including the people. So I think this cannot be an effort only of the government. It has to be the government and the people. We have to work together to fight this man.
Thank you, sir. Audience, do you have any questions? You can put your questions in the chat box so that I can read it out.
Okay, guys, just tell me, was I that good that you guys don't have a question, or was I that bad?
Thank you, sir.
All right, guys, it was a pleasure. The pleasure was completely mine, and the time I spent with you guys has been amazing. Thank you for having me. And in case something comes up in the future, we meet again. Till then, Godspeed. Cheers. Bye bye.
I'm Mrs. Jukunda. from Department of Commerce would like to present the oath of thanks. Before that, I would just like to read a quote. Coming together is the beginning, keeping together is progress, working together is success. Good afternoon to one and all. On behalf of Baldwin Cement Methodist College, principal, management, staff, and students, our sincere thanks and best wishes to the resource person of today's webinar, Mr. Mohammad Yaqub, Legal Director, Oracle Finance Service Software. Thank you, sir, for accepting our invite and sharing your valuable time, and also providing an insight on the topic disaster management and post measure, and the laws passed by the government to prevent and control the spread of this pandemic. A special note of thanks to Mrs. Anika Banu, Professor of Commerce Department, for supporting us in organizing the webinar. Thanks to all the participants for making this webinar a successful one. I'm also thankful to BCA Department and Mr. Avinash for the technical support. Thank you. Stay safe. Stay healthy. Participants note, feedback form will be sent to your registered email ID. Kindly fill in and send it back. Thank you.